Jia and Sarika. So, what I am trying to tell you during the session. Okay, guys, we will start our session now. So, today is May 14th, 2023. Fast Code 21's free medical coding CPC SDS AMS Prep Session 23 Evaluation and Management Coding. So, this is the first question of the day. Just check that this question and put your answer in the chat box. Now it is 9:30. We will discuss the answer at 9:34. So if you don't know the answer, no worries. I will explain you. But you need to find the keywords. So you need to understand the question. If you understand the question properly, you can give the answer correctly. So medical coding is like the thing which we need comprehension or interpretation. So if you interpret the record properly, you can get the code properly. Hi Divya, good morning. So Paladuk Divya means hours only. Yeah, thank you Vidya. Thank you Sarika. So anyway, you only three people now. So we can discuss the answer without wasting your time. So first, whenever we code any CPT procedure or emergency sorry, E&M, we need to check the keywords here. So Maria came today for atrial fibrillation follow-up. So basically follow-up means patient is coming second time. So this is the second visit. We need to understand. So today is the keyword. Atrial fibrillation follow-up is the keyword here. Her PCP is not in the office. She is seen by a partner physician of the same practice. So thank you, Vidivya. So this is the second keyword here. Blood pressure is 120/75, pulse is 68, chest is clear. So physician perform medically appropriate history and medically appropriate exam. So this is the third keyword. And medical decision making is straightforward. So this is the fourth keyword. So basically we need to interpret the report now. So Maria came today for atrial fibrillation follow-up and her PCP is not in the office. So partner physician saw the patient with the same in the same practice. So based on as all of us know, based on E&M coding guidelines, if the patient is seen by the physician who is working in the same practice, we can code it as established patient. So here we have two codes related to new patient and established patient. So 203, 202 are for established patient. So we will remove those two codes. As this patient is established patient, 202, 203 are for new patient. So we are looking for established patient now. So we need to check 212 and 213. So we will check. So what is 212? Office or other outpatient visit for the evaluation and management of an established patient, okay, which requires a medically appropriate history and examination and straightforward medical decision making. So here, and what about this one? 213 is for low level of medical decision making, but based on our question, it is straightforward medical decision making. So 99212 is the answer. So you need to find 99212 is the correct answer for this session, as this patient is a established patient, not new patient. So anyway, it is good that all of you wrote correct answer. No worries. So try to find the answer for second one. Okay, 1 second. I will make it down. Yeah. Now we can check this. So now it is 9:36. We will discuss it at 9:40. If you wrote fast, we will complete this session is also very fast. So whenever we code, just concentrate on medical decision making. So based on that, you can find the answer easily. So we have 2 more minutes left. No worries. So instead of sitting idle, trying something is better. Yeah, good morning, Ramadevi. Thank you very much for your time. So as you guys have requested evaluation and management, today we are learning evaluation management. So you guys have only 1 minute left. No need to worry. Whatever you know, just write the answer. So anyway, our people are doing good. So, so now it is 9:40. So we will discuss our answer. So a 37-year-old patient came to ER with wheezing and tachycardia. This is the first keyword. The ER physician documented medically appropriate history and exam and medical decision making of moderate complexity. Okay, fine. This patient was being given 3 nebulizer treatments. Okay, ER physician has decided to place him on observation care unit. This is the third keyword we need to understand for acute asthma exacerbation. So ER physician will continue examining the patient and will order additional treatments until his wheezing subsides. How do you code for this service? So basically here, what is 99284? So as all of us know, 99284 related to ED services, emergency department services. But based on the guidelines, if the ER physician admits patient to the observation unit, we need to code observation unit code, not ER physician code. So hence we will cross A and C. So here ER physician transferred or placed the patient on observation care unit. So we will not code 99284 here. So we will eliminate A and C. So here we need to check 99222 and 99235. So 99235 is for observation unit admission and discharge on same day, but which is not occurred here. If you check here, ER physician will continue examining the patient and will order additional treatment until his wheezing subsides. So meaning patient is not discharged from the observation unit. So we will not code 99235. So we are left with 99222. So if you check 99222, so what is 99222? Initial hospital inpatient or observation care per day for the evaluation management of a patient which requires medically appropriate history under examination and moderate level of medical decision making. So based on our second keyword along with this rationale, our answer will be 99222. So here important point you need to remember is if the physician like ER physician admits patient to the observation unit, we need to code for observation care unit, not for emergency department physician. So most of the people wrote correct answer. No problem. If you don't write, no need to worry. Just try to remember we need to code for observation care unit, not for emergency department physician here. So okay. So we will check third one. Yeah, go ahead. Now it is 9:43. We will discuss the answer at 9:47. So no need to worry about this. So if you don't understand anything, send your concern to Vincent Medical Coder at the rate of gmail.com. So we will discuss that whenever we have live session. So these are easy only. Just we need to remember the guidelines. If you remember the guidelines, you can write or you can code very easily. So all of you put third question answer in the chat box. Don't worry about whether it is correct or not. Thank you, Divya. Thank you, Sarika. So yeah, anyway, most of the people wrote the answer. So we will check now. Roderick came with bleeding from nose and was admitted to the observation care unit. So this is the first keyword. In the afternoon at 1 p.m. medically appropriate history examination were performed. Okay. So this is the second one. And here medical decision making is low level complexity. This is the third one. So the patient was kept in observation for 4 hours. Okay. And Roderick was discharged in the evening at 5 p.m. Select correct code for this service. So as we have discussed just now, we need to remember two codes in observation services. So one is initial observation care and the second one is observation care including admission and discharge on same day. So here based on our scenario, patient is discharged on same day. So we will eliminate B and C. So as B and C related to the observation care, here patient will not discharge on the same day. 234 A and D related to the observation care, admission and discharge on same day. So among 234 and 235 we need to select the correct answer. So based on our keywords, low level complexity. So here 234 is straightforward and 235 is low level of medical decision making. So we will select 234 is the correct answer here. So our answer is 99234. So yes, same day discharge along with low level MDM. So 234 is the correct answer. So check fourth question now. So just you need to remember the keywords and whether it is surgery, E&M, whatever it is, even in ICD 10 CM also, just you need to find the keyword. If you are able to identify the proper keyword, you can do coding properly. So now it is 9:49. We will discuss the answer at 9:54 based on the answers received in the chat box. Don't worry whether it is correct answer or wrong answer. No need to worry about that. Just try to write the answer. So if you write only, you can know that you are doing good. If you don't write anything, it is not good. So that you are not interested to learn. So even CPC exam also, you don't keep the any answer in blank. So you need to put any answer using your sixth sense. If you don't know the correct answer, don't try to leave any question in CPC exam. Try to put whatever you know. So don't worry about the answer. Just thank you, Sarika. Thank you, Vidya. So Divya and Ramadevi needs to send the answer. Yeah, thank you, Dinu. Thanks for visiting Passcode of 21. So we will discuss the answer. Anyway, you guys wrote correct only. So Stanley was admitted to the hospital 4 days ago for acute diverticulitis. Okay. During the hospital stay, he was seen in consultation. Okay. And was placed on intravenous antibiotics and has made slow and steady progress. Today, his condition became normal without any abdominal pain. Labs are normal and CT scan showed changes consistent with diverticulitis in the left side of colon. He was given follow-up instruction to continue his medication and diet. He has to return if pain starts again. Total time spent with was 40 minutes today. So this is one keyword in order to code properly. On the day of discharge, how do you code for this service? So basically what is 99252? 99252 is for inpatient consultation. So but here patient is discharged also. So we need to think that. So C is wrong answer. So 9928252 is for only inpatient consultation, not for discharge. So we will eliminate C. So we are left with, we will check 99233. So what is 99233? It's a subsequent hospital inpatient or observation care. So which is not a subsequent care. So we will eliminate D also. And we are left with A and B. So as it is very easy, based on the 40 minutes time mentioned in the here in our question, we will select 99239. So 99239 is the answer for 40 minutes. So here, if you check 99238, hospital inpatient or observation discharge day management, 30 minutes or less. If you take 99239, more than 30 minutes on the date of the encounter. So based on our question, here 40 minutes, total time spent with the patient was 40 minutes. So we will select 99239. Thank you guys. So we will go ahead with and learn fifth question now. Yeah, this is the fifth question. I hope everyone can see. And today we have published one video related to musculoskeletal system, step by step series. So last week we have published step by step integumentary system coding. Today we have published step by step musculoskeletal system coding. Next week we will publish step by step respiratory system coding. So please watch those videos also. Now time is 9:57. We will discuss the answer at 10 o'clock. So just try to find the keyword. If you find the keyword, you can code properly. So you guys no need to worry about the answer. Just you need to worry about whether I am learning or not. So if you write something only, you can remember for the next time. If you don't write anything, it's not good. Yeah, thank you, Sarika, Vidya, Divya, Ramadevi. So you all are correct. No worries. So basically, it is very easy only. So 99221. So we will check the question first. A 54-year-old patient was admitted yesterday to the hospital with cholelithiasis. Today, the physician performed a medically appropriate history and examination, recommended him to undergo cholecystectomy, which is considered as high complexity medical decision making. Identify the correct evaluation management service code number for this procedure. So, what is 99221? 99221 is initial. Where is it? One second. So 99221 is initial hospital care. So which is not occurred here. So we will eliminate B. So we will check 99253, which is inpatient consultation. So which is also not correct. So we are left with C and D. 99233 and 99234. We will check those two. 233, 234. So what is 234? Hospital inpatient or observation care for the here what is the select subsection for 99234? Hospital inpatient or observation care services including admission and discharge services. But here discharge is not occurred. So physician has guided the patient to undergo the surgery. So we will check 99233. So what is 99233? Subsequent hospital inpatient or observation care. So physician has informed the patient to undergo surgery. So it will become subsequent visit. So this scenario is related to subsequent hospital care and high level MDM. So here our answer is 99233. So this is the sixth question. So now it is 10 o'clock. We will discuss the answer at 10:05. Hi Deepak, good morning. So if you would like to have more sessions, please click on like button so that it will motivate me and provide more important sessions. So if you have any concerns regarding topics, you can mention in the Fastcoder 21 comment section. So we will try to create sessions related to those topics. So it is like everything based on your interest. So everyone is having some drawbacks in order to learn. If you feel something is difficult for you, mention in the comment section. So we will learn together. So based on our scenarios, in E&M section, you need to remember the subsection headlines or subsection headings. If you remember those, you can eliminate wrong answers very easily. Try to remember the subsection. So Bhavan Prasad, sure we will discuss, but not now, after this session. So we have 2 more minutes. Now it is 10:03. Yeah, no worries. After this session, I will give you 5 or 10 minutes based on your queries. No need to worry, Bhavan Prasad. I will guide you. So thank you, Sarika, Vidya, and Divya. So we will discuss the answer now. So a 76-year-old lady with cataract is seen by her PCP. So PCP means primary care physician. So her PCP has suggested surgical removal of cataract and referred her to an ophthalmologist. This is the keyword here. Ophthalmologist performed medically appropriate history and examination and confirmed the diagnosis of cataract. So medical decision making complexity of low level. Thank you, Deepak. Which of the following E&M service code is to be given? So we will check option A. So option A is inpatient consultation, which is not occurred in this session. So we will eliminate 99253, which is A. And option B is ED services. So but basically this question is not related to ED services. So we will eliminate B. We are left with 99243 and 245. So we will discuss those two. What is 99243? 243 subsection heading is office or other outpatient consultation, new or established patient. So based on medical decision making, we need to select 43 or 45. So what is our medical decision making? It is of low level. So 99243 resembles our case description. So our answer is 99243, where we have low level of medical decision making. And if you take 99245, it is having high level of medical decision making. So based on this rationale, our answer is 99243, because we have low level medical decision making. So this is the seventh question. Try for this, guys. So anyway, all of you guys doing good. Good that you people know E&M very well. And also remember, we will provide trainings for CPC, CCS, CIC, ED, E&M, and also CPMA. So if anyone wants to have trainings for this certification, you can contact us. We will provide trainings also. So remember, irrespective of trainings, our free sessions will continue. So now it is 10:07. We will discuss the answer at 10:10. So while coding E&M, try to remember the headings of each and every section. Yeah, thank you guys. You are doing a wonderful job. So you have 1 minute left. So time over now. So we will discuss this question. A 48-year-old patient is admitted for treatment of liver. So you can think that any type of liver disease. Consultation service is requested by attending physician. This is the keyword here from interventional radiologist. Okay. Radiologist obtained medically appropriate history and examination. Okay. Showed that lungs were clear to auscultation and the heart and had regular rate and rhythm. Computed tomography guided liver biopsy was suggested for this patient. Medical decision making was of high level. So we need to check the answer for this. So first we will go ahead with low level code. What is 99223? So 99223 is for initial hospital care. So which is not occurred here. It is not hospital care. So we will eliminate 99223. So we are left with A, B and D. So we will check 99245 next. So 99245 is for office or other outpatient consultation. So here this is also not correct. Why means it is a inpatient service. How do you identify it is inpatient service? Here it is mentioned as patient is admitted. So if it is a outpatient service, patient will be discharged on same day. But that is not occurred here. So we need to consider it as a inpatient service. So we are left with B and D. We will check 99254 and 255. So what is 99254? Inpatient or observation consultation. So you need to think that it is a inpatient consultation and you need to check the medical decision making. So for 99254 we have moderate level of medical decision making. For 99255 we have high level of medical decision making. So because of this reason our answer is 99255 as we have high level of medical decision making. So anyway all of you guys are writing good. So check eighth question answer guys. So So it will take some time, I think. Now it is 10:13. We will discuss the answer at 10:17. So if I get the answers, we will discuss. So my intention is to help the coders. I will give you the sufficient time. So before we discuss any answer, I need minimum 3 answers from yours. I need answers from 3 people or 3 coders so that we can discuss. So just you need to interpret the report properly, whether it is ED, observation, consultation, inpatient admission. So if you understand the question, you can provide the answer very easily. So you guys no need to worry about the answer. If you want to learn, you need to put any answer in the chat box. Hi Akash. Sorry. Hi Lucky. Good morning. So what do you guys feel? The morning is good or night is good for our live sessions? So anyway, I will conduct one poll in our WhatsApp groups and Telegram groups. So here I am posting our Telegram, sorry, WhatsApp group. If anyone wants to join, you can join now and also share these links to your friends. They will get benefit from our sessions. So, and if you have any complex topics, please mention in the comment section. So I will create videos for next week if you feel something is very difficult for you. So now we will check the answer. Thank you guys. Thanks for your likes. Surely it will motivate me and provide valuable education to you. Okay, we will discuss our answer now. So a 41-year-old male patient is admitted last week. Okay, admitted is the last keyword as we discussed previous question. So admitted means it is a inpatient visit. So he developed onset of dyspnea on exertion and chest pain. Inpatient cardiologist consultation is requested by attending physician. Cardiologist performed comprehensive history that revealed that patient can't walk 3 blocks without exhibiting retrosternal squeezing sensation with shortness of breath. Okay. He relates that he had the first episode 3 months ago, which he attributed to indigestion. Okay. His medical history is negative for stroke, tuberculosis, cancer, or rheumatic fever, but includes seborrheic keratosis and benign positional vertigo. He has no allergies. A comprehensive physical examination reveals a pleasant elderly male in no apparent distress. So this is whole related to physical examination, normal carotid volume and upstroke without bruit. Chest examination shows clear to auscultation with no rails, crackles, crepitations or wheezing. Cardiovascular examination reveals a normal PMI with RV lift, normal S1 and S2 with an S3 without murmur or noted. So one of the important keyword here, medical decision making of high level based on the various diagnostic options. So based on our code description in the question, we need to understand that it is a inpatient admission. So as here admitted, but in this question, physician did not mention that patient is discharged. So it is inpatient service. So we will check 99223. So 99223 is for initial hospital care, which is not here. So we will eliminate A. We will check 99245. So what is 99245 here? So it is outpatient consultation. So it is not outpatient consultation, it is inpatient consultation. So as I told you guys, whenever you learn E&M section, try to remember the subsection heading so that you can code properly. So using subsection headings only you can write and you can save your time while writing the CPC exam. So we will check 254 and 255. So as we have high level of medical decision making, our answer is 99255, which is for inpatient or observation consultation. Okay, because of this rationale, our answer is 99255 as inpatient consultation with high level medical decision making. So thank you guys, all are doing good. So we are going to learn last question of the week. So this is ninth one. It is 10:20 now. We can discuss the answer at 10:24 as usual based on your reply. No, Lucky, it is good morning only, not night. So because I have some work in the evening, so I thought it is better to help you guys in the morning time. So I don't want to miss your learning process. I want to help you guys as much as possible. So you no need to worry. If anyone joined lately, you can watch the recording tomorrow, no problem. And also encourage your friends to join in or watch our videos, which are more informative, and these are helpful for all types of coding specialty. As all of you know, our channel is having videos related to all coding specialties, including IVR. So as you know, IVR is most complex specialty is medical coding along with inpatient. So we will discuss the answer at 9:25. So no need to worry about the answer. Just write whatever you know in the chat box. So first of all, whenever you code these services in them, try to see the section headings. Using section headings, you can code properly. Yeah, thank you, Ramadevi, Deepak, Divya, and Vidya. So we can discuss the answer now. So Rupert presented to the hospital with complaints of fever, malaise, chills, chest pain, and a severe cough. Okay, Rupert presented to the hospital. Okay. So why I am selecting this as a keyword is here patient is admitted and we need to check whether patient is discharged or not. As you know, based on admission and discharge, we have E&M codes. Next, physician admitted him to the hospital. Anyway, physician has officially confirmed here. So it is a inpatient service for treatment of pneumonia. On the same day, physician also performed a medically appropriate history and examination and medical decision making of moderate level. So select the correct CPT code for this service. So what is 99? We will check the first option, which is related to ED, sorry, outpatient service. So but it is not outpatient service based on our code, our question description. So it is inpatient service. As here physician mentioned admitted, but physician did not mention patient is discharged. So this one becomes inpatient. So we will eliminate 99204 and also we will eliminate 99214 which is in the B and also D. So and we are left with 99222 which is initial hospital care. So here our answer is 99222 as 99222 is selected because it is considered as inpatient hospital care with medical decision making of moderate level. So thank you guys. Thanks for visiting Fast Coder 21. So now it is 10:25. So if you have any doubts, you can mention in the comment section, sorry, chat box. Otherwise, Fast Coder 21 videos comment section. So I will try to clear all your doubts and encourage your friends to join in our WhatsApp group. As I have already mentioned our WhatsApp group link in the chat box. So you can copy that and share it with your friends. So if you have any questions, you can ask now. Thank you, Sarika, Vidya, Divya, and Rama Devi, and Bhan Prasad, Deepak, Lucky for attending this session. So if you have any concerns, please mention in the chat box now. I will wait for 5 more minutes. So based on your queries. Thank you, Deepak. Thank you very much for your appreciation. So my intention is to help the coders. Frankly speaking, I want to help you and I need and I am learning. So as you know, education is ocean. Every time we need to update with the new things. So not only in medical coding, whatever you are in field, we need to acquire the latest updates in medical coding field. So thank you guys. Thank you very much for your appreciation. And Bhanu Prasad, are you here now? So if you are here, just mention yes or no. If you are here anyway, you will mention yes. If you keep any yes in the chat box, we will discuss regarding your query. Otherwise, we will discontinue the session at 10:30. Thank you, Sarika, Ramadevi, Divya, Vidya, and Deepak and Lucky. Try to attend next week also, so we can discuss. And if you have any concerns, please mention in the comment section in our videos. We will plan those sessions next week. And also, if you guys are having any material for this session, please send it to Vincent Medical Coder @ gmail.com so that I can use those material for coming weeks. So directly or indirectly, you are also going to help the coders like me if you are willing to. So if you have any material, send it to Vincent Medical Coder @ gmail.com. So currently I'm using material sent by one of our good student. So frankly speaking, I don't know about billing, but if you want hick pics, how do we wish? I can create one session, sorry, one video. Surely we will learn hick pics next week. I will create one video related to hick pics. No need to worry. Thank you, Lucky. So if you have any material, please send us to send Vincent Medical Coder @gmail.com so that we can use that material for other coders. So currently we are using material sent by one of our good student, Shiv Kumar. He sent the material, so I am using those material. Send your material. I will pronounce your name in the our live session so that you will get good credit for your help to others. Yeah, sure, Sarika. I will plan pathology next week. Don't worry. So I think Ban Prasad is not here. So basically anyone can do the CPC exam. If you have a life science qualification, you can do easily. There is no restriction that only these people can do CPC exam. So anyone can do. Of course, Ban Prasad, you can do CPC exam. There is no problem with that. As you have completed D pharmacy, you are super eligible for CPC exam. Okay, guys, thanks for visiting and thanks for spending your valuable time with Fast Coder 21. So now I am stopping my session. We will meet next week. If you have any concerns, please mention in the videos of Fast Coder 21 channel. Thank you, guys. Have a good day. Bye. Take care.